COVID-19 and the strain on Utah hospitals. That's where we begin tonight on ABC4 News at 5. I'm Glenn Mills.
And I'm Emily Flores. We thank you for joining us here this evening. Now, the nursing shortage in Utah getting worse as the COVID-19 Delta variant rages on. Several nurses are quitting and pursuing other jobs because of the toll they say it has taken on their physical and mental health. ABC4's Jordan Burroughs talking to nurses today. He's live outside of the University of Utah Hospital in Salt Lake City. And Jordan, how is the shortage impacting patients?
Emily, that impact is immense. For every empty hospital bed, it cannot be occupied unless there is a nurse there giving 24/7 care. But with the nursing shortage, that may not happen sometimes, especially University of Utah Hospital, even other hospitals throughout the state. U of U's chief nursing officer told me that even this past Sunday, they had 2 employees from the medical ICU unit quit. Packed up, they moved back home because they just couldn't handle the tremendous workload anymore.
Here's what I have heard outright from people. I just can't do it again.
Again, nurses are gearing up in what University of Utah's chief nursing officer Tracy Nixon calls COVID 2.0.
This feels, acts, smells, and tastes like a nursing shortage.
Across the board at University of Utah Health Hospitals, there are hundreds of nursing jobs available, according to Nixon. More employees are quitting and leaving because of the physical and mental toll.
One of them literally said, I have to get out of here. I'm going back home.
Nixon shares that example of a member of the medical ICU quitting, and Dr. Liz Close, a nurse with the Utah Nurses Association, shares why that probably is.
They're very disappointed and they're very tired. And I think the hardest thing for nurses in Utah and across the country right now is that we don't have to be in this situation.
Nixon says nurses never recovered from the first surge of patients. Close says that's another thing driving them out.
Make no mistake, we have nurses terribly traumatized by the level of death.
Utah is about to hit 2,500 deaths from COVID-19, and as local health professionals say, the deaths are preventable if you get your COVID-19 vaccine. Nixon adds it's hard to predict an end in sight of this nursing shortage.
You want them to take care of themselves. You want them to have their needs met. It's heartbreaking, and I wish that at this moment in time we could do more for them.
Tracy Nixon, who you heard from, the chief nursing officer at U of U Hospitals here, says that nursing shortage at one point, if those nurses leave, then of course there will be no care left, or even that quality of care could diminish here at the hospital. Reporting live from University of Utah Hospital, Jordan Burroughs, ABC4 News.